IPC stands for indwelling pleural catheter. It is a soft tube used to remove fluid from your chest without the need to come to the hospital. Removing or draining the fluid can be easily performed by you or your caregiver. This will help to relieve breathlessness due to fluid accumulating in the chest. Fluid can be drained intermittently using a pre-vacuumed drainage bottle or continuously using a drainage bag. Please follow your doctor and nurse's advice on the drainage frequency and volume. In this video, we will show you how to look after your IPC and drain fluid in a safe way using a bottle drain. The main risk of an IPC is infection. The skin around the IPC can be infected, or bacteria can enter the chest through the IPC. This risk is reduced with good IPC care and strict hand hygiene. Therefore, it is important to clean your hands thoroughly before handling the IPC or draining fluid. Remove any rings. Alcohol-based hand sanitizer should be used for cleaning of hands. You may also wash your hands thoroughly with soap and water for at least 1 minute, and dry your hands using clean paper towels. Once your hands are clean, it is important not to touch non-sterile areas such as your clothing or skin. Dressing is important to keep the IPC site clean and dry. Before applying or changing dressing, remember to clean your hands first. Find a clean and clear space to work with. You will need disinfectant swab sticks, alcohol swabs, island dressing, gauze, transparent dressing, alcohol-based hand sanitizer. Remove the dressing to be changed. Inspect the IPC site for any redness, swelling, fluid discharge, and loose or broken stitches. Clean your hands thoroughly again. Clean the IPC exit site with a disinfectant swab stick in a circular manner with an inner to outer direction for approximately 4 finger breaths in diameter. Repeat the same action with the remaining 2 swab sticks. Use an alcohol swab to clean the exposed length of the IPC downwards away from the insertion site. Apply island gauze dressing over the exit site and coil the drain. Open the transparent dressing and place a gauze in the middle of the dressing. Cover the coiled IPC fully with the prepared transparent dressing. Dressing should be changed once a week or whenever it is soiled, wet or loose. We will now demonstrate how to drain the IPC using a bottle drain. When using a drainage bottle, the rate at which fluid needs to be drained varies. Some need daily drainage, whilst others require weekly drainage or less. Please follow your doctor's advice regarding the frequency of drainage. The supplies that you will need are dressing pack and bottle kit, disinfectant swab sticks, alcohol-based hand sanitizer. The items in the dressing pack and bottle kit include pre-vacuumed bottle, valve cap pack, adapter pack, blue clamp, alcohol swabs, gauze, sterile gloves, foam dressing, transparent dressing, biohazard waste bag. Before fluid drainage, remember to clean your hands first. Remove the existing dressing, inspect the exit site for redness, swelling, fluid discharge, and loose or broken stitches. Next, find a clean and clear space such as a tabletop and clean your hands thoroughly again. Peel open the IPC pleural drainage pack and place it on the clean table. Open the bottle pack and place it at the edge of the wrap. Check the bottle indicator. If it is raised like the bottle indicator on the right, the bottle is not suitable for use and it should be changed. Peel open the pack and carefully open up the blue wrap by pulling only at the edges of the wrap. Clean your hands thoroughly. Put on sterile gloves, handling the cuffs only. When putting on the gloves, be careful not to touch the outside of the gloves. The gloves should not come into contact with any non-sterile surface. Remove the protective cover of the excess tip and carefully place the excess tip on the blue wrap, which is a clean surface. Peel open the valve cap pack and carefully let the valve cap drop onto the middle of the blue wrap. Tear open alcohol swabs. Clean the valve cover of the IPC with an alcohol swab. Twist and gently remove the IPC cap. Thoroughly clean the exposed valve with another alcohol swab. Without touching the excess tip, gently insert the excess tip into the IPC valve using a twist and lock motion. A click should be heard. Slide the white clamp to open position. The bottle is now ready to use. Slowly push the slider to start removing fluid. The slider can be gradually pushed further to increase the flow. It is normal to feel some discomfort while draining fluid. If you do feel pain or discomfort, you can slow down or stop the flow by releasing the push button or releasing the slider. Do not drain more than 1000 ml at any one time. The volume that is drained out can be read off from the scale on the bottle. When drainage is complete, unlock the valve and gently remove the excess tip. Thoroughly clean the exposed valve with an alcohol swab and cover the IPC with a new valve cap. Clean the IPC exit side with a disinfectant swab stick in a circular manner with an inner to outer direction for approximately 4 finger breaths in diameter. Repeat the same action with the remaining 2 swab sticks. Use an alcohol swab to clean the exposed length of the IPC downwards away from the insertion site. Apply foam dressing around the drain. Coil the drain over the foam dressing. Open the film dressing and place a clean gauze in the middle. Apply the prepared dressing and remove the remaining plastic films according to the numbered indicators. The used bottle can be discarded in the biohazard waste bag. Used bottles should not be reused or recycled. You may continue to shower with an IPC. When showering, cover the dressing with clean plastic and secure with tape. Monitor and keep a regular record of the drainage volume and frequency. In addition, look out for any change in fluid drainage volume, color, or consistency. Any significant change should be reported to your doctor or nurse. If the amount of fluid drain decreases significantly or stops abruptly, this may be a sign that the IPC is blocked. Ensure the white clamp is in the open position. Check that the IPC or tubing of the drainage bag are not kinked. Milking the IPC may sometimes help to improve drainage. If drainage volume remains low, inform your doctor or nurse. Look out for signs of infection around the IPC site. The skin around the IPC site should be clean and look nearly normal. If you observe any redness, swelling, discharge, or experience any fever or pain, clean and cover the exit site with a clean dressing and contact your doctor or nurse. If you experience worsening breathlessness or discomfort despite fluid drainage, do seek medical attention. Thank you for your attention. We hope you have found this video useful.